Everybody, thank you for joining us tonight. First off, access to vital health care can be challenging, especially in rural communities. Well, University of Tennessee Health Sciences Center is hitting the road to make medical services more accessible in those areas. Now, there's a bonus with that new initiative because Memphis's 6 medical centers serve more than 600,000 people, including the surrounding communities. Brittany Moncrief joins us now, and Brittany, I'm sure this will help make getting in to see the doctor a bit easier and also relieve some stress on those medical professionals, right?
Absolutely, Rudy. You know, a lot of us, and I'm sure myself, have experienced, the backlog of waiting to get in to see a medical provider and even sometimes facing shortages with nurses and doctors. Well, we know there are various disparities that can prevent people from getting the health care they need, and one, as you mentioned, is access. Well, instead of waiting for patients to come to them, a new University of Tennessee Health Science Center initiative is going in the communities and going to the patients.
What looks like your average charter bus is actually healthcare on wheels. Thursday, the University of Tennessee Health Science Center unveiled its mobile health unit.
It's important to have a unit where you can go to where the people have the need.
And that need is prevalent in rural areas. According to the Shelby County Health Department, 16 hospitals in Tennessee closed since 2010. Most in rural areas, which has caused more patients to turn to hospitals in urban areas such as Regional 1 in Memphis.
The inability or the extreme inconvenience that people have in these rural communities, having to drive an hour or 2 hours to get health care.
The top 2 issues in our local community are the fact of lack of transportation in a rural area and lack of access to medical treatment.
Maurice Gaines is mayor of Lauderdale County, which has a life expectancy rate lower than the state and national average.
We have quite a large population of impoverished or folks living in poverty, and this will be able to provide them with health care that they probably would not get otherwise.
They will wait until the last minute to go to the doctor.
That hits home for nursing student Yulia Albaiva and Alicia Cox.
I'm used to rural communities and seeing how access to health providers can be a struggle.
We're immigrants, so when we came here, we didn't know a lot and we didn't know how to acquire the right health care.
The two will be working in the unit, assisting patients in Lake and Lauderdale counties 4 days a week.
It gives us great exposure. It's important that we not only service the community that we live in, but also go out into the rural areas and assist them as well.
Lauderdale County Mayor tells us they're also hoping students develop a passion for helping those rural communities and stay. Now, the mobile health unit will provide care from primary care to prenatal care to mental health. Rudy?